Hello, I'm Dr. Lane Childs. I'm a urologist. I practice with Summit Urology Group in Salt Lake City, Utah. So the causes of kidney stones are often genetic factors, but especially dietary factors. The most common reasons that we see kidney stones happen to be the obvious things that people would think about. Dehydration. Salt is a real strong stimulator of kidney stones, not because kidney stones are made of sodium, but the way the body processes sodium, it gets rid of all the extra salt. So people that have salt-heavy diets, many stones are able to be passed. But let's say if a stone is not passable, a patient continues to have symptoms. A stone which is in the ureter, or the tube between the kidney and the bladder, it tends to give a really severe pain on the one side involved. It's rare for that pain to travel over to the opposite side of the body. So if someone has a one-sided pain that tends to be working its way downward, or feel it's radiating down towards a groin or to the low abdomen, chances are it very well could be a stone. When you couple that with nausea or vomiting, that also raises the likelihood that we could be dealing with a kidney stone. If a stone gets into that ureter, it may be treatable with what's known as ureteroscopy. Ureteroscopy is a small fiber optic scope which we pass through the urethra, up into the bladder, and then we're able to pass it up into the ureter tube between the bladder and kidney to identify the location of that stone. There are small laser fibers nowadays which can help us fracture and break stones into smaller pieces to make it safe to extract the pieces. Some stones are a size which can actually just simply be carefully grasped and carefully drawn through. One wants to make sure that you're not traumatizing or injuring the ureter tube in the process. So there's a whole bunch of different types of treatments for kidney stones, and some are simply not options for certain patients depending on whether they're very obese, whether or not they're on blood thinners, whether they have active infection going on, etc. These kind of things have to be considered in the process of determining what type treatment is best for a kidney stone.